Hello everyone, welcome back to Fire Nursing Tutorial YouTube channel. In this class, we are going to discuss with top 30 midwifery and gynecological MCQs. We'll start with the first question. What is the normal fetal heart rate? These are the options given below. It's 120 to 160 beats per minute. We'll move to the second one. The best time to hear fetal heart sound. Options here. Weeks. Next question. What is the normal duration of pregnancy? Option is 40 weeks. Next question. Hormone is primarily response for maintain pregnancy. These are the options given. And option is progesterone. Next question. Which of the following is a presumptive sign of pregnancy? These are the options. Option is amenorrhea. Next question is, which of the following is a common complication of eclampsia? These are the options. Option is seizure. Serosa occurs during which postpartum days? Options. Right answer is 4 to 10 days. We'll move to the next question. When should the first dose of tetanus toxide be given in pregnancy? These are the options here. Option is when pregnancy is confirmed. Next question. Question is most common in labor. These are the options. Right option is vortex. Next question. Apgar score assessed at. These are the options given. Correct option is 1 and 5 minutes after birth. Next question. What is the for the first fetal movement felt by mother? These are the options. Option is quickening. Next, most common cause of abnormal uterine bleeding in reproductive age. These are the options given. Right option is ovulatory dysfunction. Next question is normal length of menstrual cycle is. Option is 21 to 35 days. Next question. Which of the following is used for emergency contraception? These are the options given. Is levonorgestrel. Most common site of ectopic pregnancy. These are the options. Right option is fallopian tube. Next question is best diagnostic test for endometriosis. Options given. Right option is laparoscopy. Move to the next question. Pap smear is used for detecting. These are the options given. Option is cervical cancer. We'll move to the next question. Most common benign tumor of the uterus. Options are here. Right option is fibroid. Next question. Which hormone suggests just before ovulation? Options are here. Option is LH, luteinizing hormone. We'll move to the next question. A chocolate cyst is seen in. Options given. Option is endometriosis. We'll move to the next question. Gravida refers to. Options given. Option is number of pregnancies. Next question. What is the term for a woman who has never given birth? Options here. The right option is nullipara. We'll move to the next question. Which vitamin is essential to prevent neural tube defect? Options are given. Right option is folic acid. We'll move to the next one. Most effective natural method of contraception. Options given. Right option is lactational amenorrhea. Next question is which test confirms rupture of membranes? Options are given. Right option is nitrogen test. We'll move to the next question. Primary amenorrhea with normal breast development and absent uterus suggests. Options are given. Option is malaria agencies. Next question. Which of the following is used to induce ovulation? Options are given. Clomiphene citrate. Next question. What tuberculosis are associated with? Options given. Right option is pregnancy. We'll move to the next question. Which is the best indicator of fetal well-being? Options are given. Here, right answer is non-stress test. We'll move to the next one. What is the term for the immature fetal reproductive cell? Options are given below. Right option is oocyte. Thank you. Please like, share and subscribe to my YouTube channel. Thank you for watching.